I'm Dr. Larry Santora.
I'm Heidi Cortese.
And welcome to Health Matters. You know, health information is complicated and confusing. There's much more information available today than, say, 10 years ago, but it's also much more complex than ever. During each episode, we bring you information that empowers you to make the decision about your health. Our goal is for you to learn something new each time you watch the show. I work with thousands of patients every year, day in and day out, and I know how daunting it is to get the answers you need. On Health Matters, we will explain the latest trends and latest innovations in healthcare to give you the most accurate information available.
Each episode, interesting and exciting guests are featured, including doctors, authors, and scientists who are leaders in their fields and willing to give you the straight talk.
And we cut right through the advertising hype and the misleading information you get from the media and share with you the real facts. It's news that's easy to understand and helps you focus on being healthy.
We have a terrific show for you today. We're going to see an innovative treatment for varicose veins that happens right in the doctor's office with same-day results.
And we're also going to be joined by an American icon and football legend, Dick Butkus, considered one of the most feared athletes of all time. But Dick was almost sidelined a few years ago when he found he had a serious heart condition, and he's here to tell us what he did to save his life.
But first, we're going to share some information about us. From Larry's daily hospital rounds to my routine as the developer of Leisure World, our days are focused on health.
I see about 20 patients a day in the office, and I have office hours 5 days a week, and I maybe do, besides seeing patients for follow-up and new patient consults, I do maybe 20 stress echocardiograms in the office, maybe another 5 or 10 at the hospital, and I maybe read 20 echocardiograms to 30 a week. And then I do maybe 300 to 400 invasive angiograms and stents a year. And then I've been doing CT scans for many, many years. We do thousands of those a year. What I like about cardiology the most is it's a great combination of the history and physical exam. The old-time physical exam is very important in cardiology, more so than almost any other specialty. Then we have these great technologies, scans and angiograms, and very interesting high-tech tools, defibrillators, pacemakers. And yet you don't just treat them with a device. You develop a lifelong relationship with your patients because they're with you for the rest of your life. And then you have this ability, it's one of the few specialties where you could bring back somebody from the brink of death, coming in with a heart attack, in shock, and put a stent in, and 10 or 15 minutes later, once that stent's in, they come back perfectly normal just about, and they get back to a perfectly normal life. It's a very rewarding, stressful but rewarding process. So it has the best of a surgical specialty and the best of a general medicine practice. You have the combination of both, and it's a lot of interaction with a lot of patients, a lot of technology, and a lot of interesting work.
You may wonder what makes for a healthy lifestyle. On Health Matters, we take an in-depth look at all of the components that make for a healthier, more vibrant, more exciting you. Welcome to my world.
Leisure World promotes a healthy lifestyle because it makes it convenient and easy for people to take better care of themselves. Over 70,000 people call Leisure World home nationwide. There's so many things to do there. I mean, everything from the clown club to bocce ball, aerobics, tai chi, you name it, it's there. It provides a wonderful place to live with interesting people to know and lots of things to do. And all of those things that you can do promote good health. Health is important to me because I feel a wonderful sense of harmony between myself and the world around me and the people in my life. It's important for people to actively seek out information about good health because they can make discoveries about all of those little idiosyncrasies unique to them. You're able to read a paper or watch Health Matters and you discover new things. And those things may apply to you. And that's important. You learn something new every day. And this show really provides information for a lot of people that is probably new and interesting to them.
When we return, we'll get up close and see varicose veins disappear.
One of the things that makes Chapman is the relationship between students and faculty. You can watch their faces, you can watch their eyes. You can see, when is this material connecting?
It's a different kind of learning experience if you're able to really interact with your professors more on a personal basis, kind of like you're working on something together.
History, political science, and sociology, peace studies, and legal studies. Chapman University's Division of Social Sciences, engaging in humanity, one student at a time.
Our first guest is Dr. Bruce Hoyle of the Advanced Vein Center in the City of Orange. He specializes in a new laser treatment for varicose veins.
Dr. Hoyle uses an innovative laser technique that greatly simplifies the procedure and no longer requires what they call stripping of the vein. Thanks, Dr. Hoyle, for coming. Now, what are varicose veins? How frequently do we see those in people, and what are the causes?
Larry, varicose veins are these bulging veins you often see on people's legs. It's very common. We think it's estimated 40 million Americans have them. Wow. It's about twice as common in women as in men, so being female is a risk factor. But there are other risk factors. Genetics probably plays the greatest role. There's about a 20% chance that any of us can get varicose veins, but if one of your parents has varicose veins, that increases your odds to 50%. If both of your parents have varicose veins, it increases your odds to 90%. Whoa. So genetics plays a role, and then there's environmental factors. If you're female, with each subsequent pregnancy, the likelihood that she'll develop varicose veins increases. And then there's occupational things. Prolonged sitting, prolonged standing, these can all increase your chances of varicose veins. And it's important to remember, it's not your heart that's pumping the blood back from your veins up to your heart, it's your leg muscles, particularly the calf muscles, so that's why moving around is important.
Recently, Dr. Hoyle performed this procedure on one of his patients. Let's take a look.
This is Rene. As you can see, he's got some marked bulging veins on his right thigh, so they often tend to be very painful. The more they're on their feet, the more it'll hurt. So today we're going to do an endovenous laser closure, and basically we're going to enter around his knee and go inside of a vein that's below this with a laser fiber. We'll be able to see that on the ultrasound. We'll record it there, and we're going to then put some anesthetic along the vein. He'll be awake for the whole procedure, so he'll be able to talk to us. So now this is the laser fiber here. This is what actually does the work, does the procedure. Now it's on. There's a little targeting light there. You can probably see that's not actually the laser light, but the energy will be coming out of the tip. So now we're going to insert fiber inside the tube.
Thank you.
And now the laser is inside the vein, it's in position. So now all that remains is to anesthetize the vein. There it comes. This is the anesthetic fluid that comes out. I mean, really the laser is being activated when it's in his leg, but theoretically if I was to accidentally pull it out, it would be aimed up towards his head, so having eye protection would make sense. And there's the junction coming up. You see the major vein right there, just coming into the bottom of the picture. Yeah, don't touch that one. Leave that one alone. You can actually see on the screen a little bubbling activity around the tip of the laser. You can just make it out. Just right in the center. You can actually see the laser through his skin. You can just make out the flashing. See, that's the spot where the tip is right now. Okay. Procedure's finished. You did just great, Rene.
That was really an amazing procedure. It looked quite simple. I saw the guy, he walked out of the room. I took the elevator downstairs with him. He beat me down in the elevator.
We want him to go walk for an hour at the mall afterwards.
You really go for a walk?
Yes, exactly.
This is a total new world compared to vein stripping. Why don't you describe vein stripping to us?
Vein stripping was a traditional surgery that goes back for decades, and and really was a blind procedure in the sense a patient would have bulging veins, they'd be taken to the operating room, and these veins would be surgically removed through incisions, general anesthetic, weeks of recovery. One of the great innovations was the use of ultrasound, and we brought this machine today. This ultrasound, these big ultrasound machines that you see when a woman's pregnant and they ultrasound her, have now been miniaturized down to this size, and this came out of Desert Storm technology, really. They needed something for the field hospitals that was small, battery operated, and portable. So now we're actually able to see the veins, and a lot of times the bulging veins that you see are actually due to reflux or backflow because of valve failure in veins that you can't see underneath. And in the case of that film clip, it was actually a deeper vein that we treated, hoping we'll see the bulging veins go away.
And they did.
And they did.
Can we see the laser light there?
So basically we use a needle to initially enter the vein, and after we put in a wire and then later this tube, the laser fiber goes in. A little targeting light will come on here in a second. The other thing is, this is done in the office because we use tumescent anesthesia, the same thing you use in liposuction. So it's very dilute local, and using the ultrasound we can actually watch the anesthetic go around the veins so we know it's anesthetized. And here's the targeting light at this point. The laser energy would come out, the whole vein's been numbed up or anesthetized, and then we just slowly pull this laser back through and then pull everything out, and the veins shut down.
And if you can't do this, then you can inject some agent to,
That's correct.
to help collapse
That's
the vein.
correct, Larry. So if the vein's too crooked or tortuous, sometimes you can't thread the laser fiber through there. So there is actually a sclerotherapy, which has been around for decades, is still has a place, but what's new is we take a liquid like this and we're able to make a foam out of it, and we inject the foam, and we have a little film clip we can look at in a minute that shows the foam going in the vein, and the idea is the medication then is all around the bubbles on the surface, and it actually makes it work better, it coats the vein better. So now if we take this out, you can see there's this creamy foam that comes out, and this is what's injected into the vein, and it works very well.
So are varicose veins, they're not considered a cosmetic procedure now. This is considered a medical procedure, right?
Varicose veins are medical. There will be people who will have varicose veins and say they have no pain, but eventually, well, up to 20% of people with varicose veins will eventually develop ulcers. They'll actually have sores where and even bleeding.
In the lower leg.
Exactly, in their leg, and they'll come to the emergency room because suddenly a vein, the skin over it got so thin it ruptured and just started bleeding.
Oh, dear.
And they'll present to the emergency room. So, and then things like phlebitis, blood clots are all complications of untreated veins. But certainly they will come to us because their legs hurt after they've been on their feet all day.
My
Well,
goodness.
this is fantastic technology. Thank you so much for coming today. I think this is such a great advance. I mean, I think it just will change dramatically change the treatment of people with varicose veins, and it's not a cosmetic problem. It's really a medical problem that often needs treatment.
That's right.
Thank you, Dr. Hoyle.
Larry, Heidi, thank you.
Thank you.
We'll be right back.
NFL star Dick Butkus on Health Matters when we return.
Do you want to feed the world, clean the environment, heal the sick, solve scientific mysteries that have intrigued us since the beginning of time? Welcome to the Biological and Physical Sciences at Chapman University. At Chapman, we have the ideal combination: strong academics in a personalized environment, state-of-the-art facilities, abundant resources, and exceptional faculty. So you want to be a scientist. Let's get started.
Welcome back. Our next guest is not only one of the most famous football players in American history, but he's also a health advocate and activist. NFL Hall of Famer Dick Butkus was a middle linebacker for 9 years with the Chicago Bears. He is the national spokesperson for the I Play Clean campaign, leading the effort to remove steroid abuse from high school and college sports.
Dick is a good friend of mine, and we recently wrote a book together called The OC Cure for Heart Disease. And we first met when he came to my office for a heart scan, and the results were not very good, and he went on to have bypass surgery in a few days. I believe the operation saved his life, and I think he does also. and he has since founded the Dick Butkus Center for Cardiovascular Wellness right here in Orange County. The Dick Butkus Cardiovascular Wellness Center is a nonprofit center that's been established to screen for the major risk factors of heart disease, and there's two parts to the screening. One is to screen young adults, young athletes, to detect congenital heart disease, mainly cardiomyopathies, which are weakened heart muscle, and problems with the electrical system of the heart. We do that with echocardiograms, also called ultrasound tests, and EKGs. The second part is to offer electron beam or ultrafast CT screening to pick up coronary calcium and plaque in those at risk, but this is an older age group. This is people in the 35 to 40 or older who have a risk factor. And the idea of this center is to provide this unique technology to those who cannot afford it and offer to them at very, very low cost, and that cost is supported by the Wellness Center. Did you ever think you'd be on Health Matters?
No, I never thought I'd be on a health show because just like anybody that plays professional sports, you think you're invincible. And, I quickly learned, well, I didn't so quickly learn, but I learned after I retired that, things were going wrong. And I was totally shocked when I came in and, did that EBCT scan. I thought it was all a joke because the guy I came in with was a member of the Blues Brothers. And I thought it was just this big joke, pretty nasty joke, but when I found out it wasn't a joke, it sort of turned my life around. It really did.
Yeah. And now you seem, you've done great afterwards. You've been exercising, keeping your weight down. And who's your cardiologist? Well, you must have a really good cardiologist to look as good as you do.
If I would have had a good one, from the get-go.
That wouldn't be you, Larry, would it?
Yeah. So you got to find one you could afford. So then that's who I have right now.
That's right. Yeah, you get what you pay for, I guess.
Yeah, that's it.
But anyway, after we wrote the book, and we've been trying to promote early detection of heart disease, and you've been a great advocate for that, and you're a great example what early detection can do. It saves people's lives. Now, with the Dick Butkus Cardiovascular Wellness, I know you have some designs on perhaps helping retired NFL players who are not as fortunate as you to have health insurance and another career. Can you tell me your thoughts about that a little bit?
Well, that's the latest thing going around is the steroid issue with modern players, and also with the old retired players. A lot of guys are having some problems. Whether or not the NFL really, they just don't really take care of the people that started this game years ago. And I just thought through this, because we have so many problems, I don't know what the life expectancy is for a football player, but it's around 50-some years old. Right. And if we calculate when I had my heart problem, I would have been at the upper level, because that was, 5-7 years ago. So I think there's a need for that, and I also think it's a need with our wellness center is to start looking at women. I've got some friends from all over that are firemen, and apparently you've discovered that women who are fire people have a lot of problems, are very susceptible to heart disease. Right. And so we're gonna, maybe the police and retired people who maybe just can't afford to do things on your own. Because now, and I'll sum it up, when I was playing, I was very well taken care of. Whether the doctors were really the best, I don't know, but we were taken care of. And what happens is when you leave your profession, you're just like anybody else. And I didn't think I had to see a doctor. And I hadn't seen anybody, for 4 or 5 years before I came to you with the heart thing. So I could have been, if I didn't really go there. Sure. It's something about the males that they don't want to go to doctors as much as women do. So I think that's something we've got to get across, and we've got to have somewhere where they can go, and and if I could be the front for it or be involved in it, maybe they'll come in droves instead of staying home.
And half the women die of heart disease just like half the men. It's not just a man's disease. I know you've been interested in high school kids and college football, college players. And why don't you tell us a little bit about the I Play Clean campaign?
The I Play Clean campaign is just trying to get the awareness to high school, on the high school level, to parents, coaches, and the athletes themselves that this is dangerous stuff. It's like we talked, and you did that little test, although it was a small number. What we found with weightlifters and former Mr. Universe who were on steroids that it really does some damage to their insides. And we want to get the message out to the young high school athletes, like, listen, the chances of you of making it to pro level are maybe 1 in 10,000. Are you going to risk that over maybe at 30 years old, you're going to have the insides of an 80-year-old man? I don't think the odds are that good.
How are these high school students getting the steroids in the first place? Are they getting them from trainers or?
Some of them get them from the high school coaches.
From their coaches, really?
Some. I'm not, but look up on the internet.
Really?
It's that prevalent all over.
That prevalent?
Yep.
Now, when you were playing professional sports, were you aware when your trainer came in, for example, and gave you a shot for maybe your joint or a shoulder or whatever? Were you aware of what they were giving you at the time, or did they just sort of do whatever they wanted to do?
No, that was the pro level, and I never had been injected before a game. It was always after. I had knee problems. And he would shoot hydrocortisone.
Hydrocortisone.
But what had happened over the years of getting these shots almost every week for 9 years, that's why I had to have a knee replacement, because I think the bone deteriorated from all those shots. But it doesn't matter. I mean, if all I wanted to do was play, and back then you had to play. If you didn't play, you didn't get paid. So I'm going to entrust my career on this team doctor, which maybe is not that smart, because you follow him, you do what he says, and now I look back and all the guys that are messed up, but you don't know that at the time. And I know there's skeptics out there saying, well, what'd you play for? You knew you were going to get hurt. Well, when there's something you love to do, you do. Just like there's firemen, there's policemen, they're all dangerous jobs.
Right.
But at least they have a nice pension and whatever.
Right. Where the football players don't, and that's why your foundation is so wonderful.
Well, that's, and there's a pride deal. I know if I was down and out, I wouldn't, be coming, hey, look, I need help. That's right. One of the main problems is finding these people that are, not doing so well either physically or financially, and just helping them. What's wrong with that? They're the guys who really allowed the Peyton Mannings and everybody else to be making $20 million a year.
Exactly.
To be frank.
And now the same injuries that you had as a professional football player today, how long, for instance, would that same injury take to heal as opposed to when you had that type of knee injury?
No telling, because back in those days, if you had knee surgery, you would be required to be in a cast, a full cast. Usually 6 weeks, and then you got to try to break the adhesions. It's, it was really not a nightmare. The advances in strength training, nutrition, everything is so advanced now. I thought I heard, this Rivers, before they played the Patriots, he had a scope, during the week prior to that game, and he played. Gutsy guy.
Unbelievable.
So, yeah, it's totally different. The advancements is night and day right now.
Dick, we have this picture of you. I wonder if you can just spend 2 seconds and explain it to us.
This picture was taken when it was a game against the Washington Redskins, against George Allen, who was was the coach of the Redskins, but he really was my rookie coach. I got kicked above the eye, and you could see the patch by the eye there. But we were losing. We scored. I was on the point after team, and it was a bad snap. The ball was snapped 40 yards downfield, and I was the up back, and so I just kind of like wandered into the end zone. I'm looking, and then I see the quarterback scrambling for the ball, and I wave, and he throws it to me, and I had been kicked in the eye, and it started to swell up, and it was closing on me, and so I lost my depth perception, right? And so here comes the ball, and I jump up, and the ball was right there. I could have just stood there, but I jumped up, caught it, and we beat them by 1 point. And the Redskins had to either win that game or the next game to get in the playoffs. But then I was looking at it, and I said, oh, man, if I would have dropped this.
That would have been it. Thanks so much for coming. Legendary football star, American icon, and the best friend you can ever have, Dick Butkus. Thank you, Dick.
Thanks.
We'll be right back.
Storytelling at Dodge College is really the essence of what we do.
Storytelling is what it's all about.
Facilities at Chapman are fantastic. We have state-of-the-art sound stages, better than you'll find anywhere in Hollywood.
We encourage all of our students to be making films.
They're not just taking classes, it's like every class is a training workshop.
We put a camera in students' hands day one.
And we give a very real practical dimension to what we teach.
The opportunity is phenomenal here. You can't find a better way to learn about being a filmmaker than coming to Chapman.
Welcome back. Each show, we take a look at the headlines and the latest medical studies that have been released to explore a hot topic.
And we're going to dig beneath the hype and take the mystery out of medicine and explain to you in plain English.
Today's hot topic is about how eating your veggies may reduce your risk of dementia.
You know, dementia is a real worry to everybody these days. Alzheimer's and other types of dementia.
Especially me.
And especially you, me too. And the problem is we don't really know what causes it, but a recent study showed that people had green vegetables had a much lower incidence of dementia than people who didn't, probably due to the folic acid in the green vegetables. Another study showed that the Mediterranean diet, which includes grains, green vegetables, omega-3 acids like you get in fish, and olive oil, that may benefit through the anti-inflammatory properties of like fish and olive oil. It cuts down the inflammation maybe on the neurons and nerve cells. So it's what we always thought, they're healthy, but now there is some evidence that they do cut down on dementia, vegetables and a Mediterranean diet. It's
I
really
hope I don't
important.
forget.
I hope I don't forget either, but it's an important study.
We'll be right back.
Do you want to get connected to the best companies in the world? Learn from professors who excel in the classroom and the workplace. Forge relationships which will benefit your career over a lifetime. At Chapman University's arduous School of Business and Economics, our MBA and Executive MBA programs combine the best of business theory and practice. From top executives on our Board of Counselors to our national reputation, Chapman's MBA and Executive MBA programs are your connection to business success.
Thank you so much for joining us. Next time we'll talk with Dr. Matt Budoff about cardiac CT technology. These are CAT scans of the heart. Dr. Budoff will explain how this non-invasive technology could save your life.
And Larry, take a good look at my forehead. On our next show, all of you are going to join me as I get Botox injections with Dr. Dory Gilbert. We'll get to ask him all the questions we've ever had about getting rid of wrinkles.
I'm Dr. Larry Santora.
I'm Heidi Cortese.
And remember, your health matters.
Be well.
You know, what causes varicose veins, and typically family history is probably one of the biggest risk factors, and in fact his mother had a history of varicose veins. So they often tend to be very painful. The more they're on their feet, the more it will hurt. So prolonged standing, sometimes prolonged sitting. Often when they elevate their legs, they'll feel a lot better.